Hello, welcome to the One TDC Dental Report Card. Hopefully you have one of those already with you, and make sure that you take a little gauze with you. I'm gonna teach you how to use both, and I have one goal in mind today. If you have one of those guys up there, or if you have one of those beautiful cats like Marmalade, well, what we want to do is we know that a healthy mouth is the gateway to a healthy body. And we want to keep those beautiful, look at beautiful mouth of Marmalade there opening right up. We want to keep that mouth as healthy as possible. And that's why we created the dental report card. And what we're going to show you in really simple steps is how to make sure your cat or your dog's mouth is not in pain. Why? Because oral disease can be very, very painful. So let's get into this. Well, first let me just give you a very simple statistic that you all need to know. Oral health is a huge problem. 80% of cats and dogs by the age of 3 have some form of gum disease, and very often it's actually quite painful. So in the dental report card, what we're going to be focusing on is a few key things. We're looking at 3 key notions: tartar, as you see up there, tartar, plaque, and inflammation. So what we're going to do is we're going to measure those 3 elements. So what you just saw there get in red is pain. I want to make sure to find out if your cat or dog is in pain. I don't want them to be in pain, and neither do you. We want to know through this quick evaluation with the dental report card if you need to see your veterinarian. That's the goal. So let's get into this. All right, specifically, we're going to do this with very simple steps. Colors. We're going to evaluate through very simple color schemes. Well, we all know that if it's green, it's good. If it's yellow, not so good, and bad, well, that's when you're in the red, and often that happens. So what does that mean exactly? Let's open up and see what's inside here. So in the good section, it's basically, as you can see right there, is you have clean teeth. They look pearly white. You have beautiful gums. The breath is fresh. You know, sadly, that doesn't happen often, but if you have that for your cat or your dog, we want to make sure that you're preserving it, and most likely you'll start using the One TDC if you're not already doing it. We usually start at 6 months old. Prevention is the key. Now, if you're in the yellow, so the not so good, you're seeing the images here. We have some mild bad breath. You can smell that. Some inflammation. You see some redness around the gums, and you can see a little bit of yellowish areas on the teeth. Well, the truth is that can actually be painful for them. So if you're in that section, it already requires your vet's attention. You want to have them check it for you. So if you are in the red, as you see here, that's the bad. So, I mean, we've all seen mouths that have that yellowish, that yucky stuff stuck on the teeth. That's tartar and plaque, and the breath is usually horrible. I just want to tell you this. It is not normal. Bad breath in your cat or your dog is not normal. It does require attention. And if you see those gums that are really sensitive, they look like they're painful, that's most likely because they are, and it's usually bloody. So let's go into what do you do next. Well, if you see any of this, you're going to measure it up here, as you see up there. So you're going to mark the tartar, you're going to mark then the plaque section based on what you've seen, and I'll teach you how to do that with the gauze next. And then, of course, if it's inflamed and it's red, of course you want to take action on that. So what are you going to do? Well, you're going to use the One TDCs that you see down below to protect that mouth proactively, and most likely you're going to be calling your veterinarian pretty quick. But and you can learn how to use the One TDC for your dog or your cat. You got a little QR code there. Just hover around your phone and you'll see a video how to give it to them. Now, in addition to that, well, you should be brushing the teeth. Most people doing that? Sadly, no. But what is the veterinarian going to be doing? If you're in that position, what your veterinarian is going to do for you is a few key things. One is they're going to check in the mouth. They're going to do a proper, thorough investigation, and then they might do a recheck, as you see down below, that little arrow that came back. They may make that determination. You take that dental report card to them so they can further evaluate what needs to happen next. They may want to do a procedure. It may be so bad that you definitely might need a dental cleaning, and in this case, it's absolutely the right thing to do for your pet, and they'll schedule that for you. Okay, so this is a really quick rundown on seeing what it looks like on the inside of the report card that you're going to be doing. But I want you to remember that you also need a gauze. Why? Because that gauze, as you will see, is actually how you're going to make the determination if there's an inflammation or tartar and plaque. Let's look at the inflammation of how to use the gauze. And you can do the rest for the plaque and the tartar yourself with the little QR code. But how do you do it? Very simple. So if you look down below, there's a little QR code here, right there. And when you click on that with your camera, it pops out this video that you can see. That video then shows you how to go over the gum line of your dog with the gauze, and then you can see the blood there on that dog. Well, what do we know about blood? Well, most likely it's painful, it's in the red, and remember the red section? It requires urgent attention from whom? From your veterinarian. Why? Because most likely your dog is in pain, so you want to do something about that. So now you've done your own evaluation at home, you've determined the tartar, the plaque, the inflammation, and with the gauze technique like you just saw. And then for the plaque or the tartar, well, the tartar you can pretty much see it, but for the plaque you just go over the teeth, not the gums. That's what the other video will show you when you look at that. It's super simple. Just do that grading, be proactive, make that investigative determination of whether or not you have pain in your cat or your dog's mouth, and then call your vet. When you see your vet, what's going to happen is they're going to tell you right off the bat that you should be probably using the 1 TDC, and most likely you're already doing that to protect the gums. Now, I want to be clear, 1 TDC promotes healthy inflammatory responses. You should do it when they're 6 months old to be proactive, but the truth is you still need the removal of tartar and plaque. While indirectly 1 TDC will help with that, in some cases it's just not enough. You absolutely need to see your veterinarian, and you need to have a mechanical removal. And they may determine that you need a dental cleaning, but you've had the chance to do your own proper evaluation first. I want to thank you for watching this video, and if you have any other questions for us, you can contact us at contactus@workssowell.com. Investigate that mouth, use your dental report card, and call your veterinarian as necessary. Thank you for watching.